Welcome back to Medicine Simplified. Today we are going to decode the difference between typical and atypical Parkinsonism. It is an important yet often misunderstood topic in neurology. So let's make it simple. So, what is Parkinsonism? Parkinsonism refers to a syndrome, not a single entity. It is characterized by number 1, bradykinesia, number 2, resting tremor, number 3, rigidity. There is also a feature you can call plus minus number 4, postural instability. Okay, so there are 4 features. Number 1, bradykinesia, number 2, resting tremor, number 3, rigidity, plus minus 4th one is postural instability. So as we have said in the earlier video, that these motor features caused by degradation of dopaminergic neurons which are located in substantia nigra. Okay, loss of dopaminergic neurons. Okay, now let's go to typical and atypical variety. Now, what are the types of Parkinsonism? Number 1, that is typical Parkinsonism. Commonly this is called Parkinson's disease. Okay, so typical Parkinsonism is called Parkinson's disease. And what is number 2? Number 2 is atypical Parkinsonism. So let's talk about typical Parkinsonism. Typical Parkinsonism, what we called commonly Parkinson's disease, is a progressive neurodegenerative disorder. It is a progressive neurodegenerative disorder with features of number 1, asymmetrical onset. Onset of both sides are not usually seen. It is seen usually on one side, then it will gradually affect the other side. Number 2, presence of resting tremor. Number 3, very slow progression. So typical Parkinsonism means like there will be asymmetrical onset, resting tremor will be positive, will be present absolutely, and the disease progression will be very slow. And 4th one is very good response to levodopa. I will talk about in details when we will talk about the management of Parkinsonism. Now just hear the word levodopa. It is the primary medicine in the treatment of Parkinsonism. So the typical Parkinsonism consists of features like asymmetrical onset, positive resting tremor, slow progression of the disease, and very good response to levodopa. Now, what will be the pathology behind it? That there will be loss of dopaminergic neurons in substantia nigra, and in slides in pathology under microscope, what we will see? We will see a collection of Lewy bodies collection of Lewy bodies. It is, what is Lewy body? It is an abnormal aggregates of alpha synuclein. Yes, these are enough for you in theory. That what will be the pathology? The collection of Lewy bodies, and what are Lewy bodies? Are abnormal aggregates of alpha synuclein. Now let's come to atypical Parkinsonism. So atypical Parkinsonism, what is atypical Parkinsonism? Atypical Parkinsonism includes a disorder that mimics Parkinson's. The feature will have like Parkinsonian features, but it will be having an additional red flag signs. Okay, but other red flag signs. So when to suspect that this person not only have Parkinsonism, but it has features of atypical Parkinsonism. Okay, so the red flag signs are: number 1, early frequent falls. Okay, number 2, rapid disease progression. As I have said earlier, that typical Parkinson does not progress rapidly. It has a very slow progression of the disease. But in case of, if the disease progress very rapid, then suspicion should be on atypical variety. Okay, and number 3, early speech issues. Okay, number 4, autonomic failure. Autonomic failure like orthostatic hypotension. Very good. Orthostatic hypotension. Number 5, supranuclear gauge palsy. I'll be having the discussion later on about supranuclear gauge palsy. So don't bother. Number 6, the response to levodopa will be very poor. Poor levodopa response. See, in typical Parkinsonism, the response to levodopa will be very good, but here atypical variety, the response will be very poor. Along with, there will be early frequent falls. If there is early frequent falls or very rapid progression of the disease, or early initiation of speech issues, autonomic disturbances like orthostatic hypotension, unexplained tachycardia, supranuclear gauge palsy, and poor response to levodopa, atypical Parkinsonism should be and must be suspected. Okay, so now I will be coming to the key differences in a slide between typical and atypical variety. So now let's take a glance on what will be the key differences between typical and atypical Parkinsonism, and it will be very easy for you. So now let's see what will be the onset. As I have said, in typical Parkinsonism, the onset will be asymmetrical, and in atypical will be symmetrical, often symmetrical. Okay, progression, the disease progression will be very slow in case of typical, and in case of atypical, progression will be very rapid. Okay, tremor very common in typical variety. Atypical, it is often absent. Okay, and which tremor? Resting tremor. falls are frequent falls in typical Parkinsonism, it will be a late feature, but in atypical Parkinsonism it will be very early. Okay. Eye signs usually rare or not present, and usually present, and what kind of like supranuclear gaze palsy. Okay. Autonomic symptoms very mild or absent or in late, and in case of atypical very early, like unexplained tachycardia, resting tachycardia, orthostatic hypotension, etc. And last but not the least, response to levodopa. It will be very important. Response to levodopa will be very good in typical variety and very poor will be in atypical variety. Okay, so it is a glance of key differences of typical and atypical Parkinson's. So what are the examples or conditions are of atypical variety? Number 1, multiple system atrophy. Number 2, progressive supranuclear palsy. Number 3, corticobasal degeneration. Number 4, dementia with Lewy bodies. Multiple system atrophy, MSA, PSP, progressive supranuclear palsy, corticobasal degeneration, CBD, and dementia with Lewy bodies, DLB. So these include in atypical Parkinsonism, and I have already said what will be the red flag signs behind the atypical Parkinsonism. When will you suspect? Okay. So as we have discussed in this chapter, typical and atypical Parkinsonism, that Parkinsonism is not only a clinical entity, it is a clinical syndrome. Parkinsonism is a clinical syndrome. The most common cause is the typical variety, or which we have called Parkinson's disease. Okay, and it is the typical variety, usually called Parkinson's disease. And atypical variety are rapid progressive, faster, and is comparatively rarer and treatment resistant. Okay, so that's it about the typical and atypical Parkinsonism. If you found this helpful, don't forget to like, share, or subscribe to Medicine Simplified. Drop a comment if you want a detailed video on each atypical subtype. Till then, stay curious and stay updated. Thank you.